Hi, welcome back to another video. You may be wondering why you are still suffering from recurrent back pain even though you take particular care of your posture, performing the correct stretches and strengthening exercises. Well, if your trigger point recurs in spite of adequate treatment, you need to look for the perpetuating factors, such as the mechanical stresses that maintain them. For example, one of the perpetuators of your lower back predicament could be originating from as far down the kinetic chain as your feet. During functional movements, the body must maintain its center of gravity aligned over a constantly changing base of support. If a change in alignment occurs at one joint, changes in alignment at another joint must occur to compensate. Although it is natural for the foot to pronate during walking or running, for individuals with overpronated feet, the internal rotation of the knees and hips is exaggerated. This hyperpronation of the foot induces a compensatory anterior pelvic tilt, and this is correlated with hyperlordosis, leading to muscle imbalances, subsequently causing lower back pain. So, if you suffer from repeated episodes of back pain with no means of relief, apart from just paying attention to your back and glute muscles, you may have to check your ankle alignments. If you have flat feet, this may have contributed to the recurrence of your lower back problems. It is important to care for the feet properly, since they can lead to pain, stress, and imbalances in other parts of your body. So, working to treat your flat feet can help to bring your entire body into alignment. This may help to correct other issues in your body that have been caused by flat feet. In this video, I will share with you some non-surgical solutions, the best corrective exercises you can do to help to correct your fallen arches and reduce pain. Aim to do these exercises at least 3 times per week. Ideally, you can fit them into your daily routine and perform them throughout the day. If you like this video and find this useful, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is completely free of charge, but will help the channel to grow. Thank you. Typically, you would stretch to loosen your muscles, but in the case of flat feet, stretching is a bad idea. Because there's already some instability, stretching can over-lengthen your tissues, which can cause further instability. So instead, you should address those tight spots through massaging. You can massage your foot with your hands. Or gently roll your arch over a trigger point ball for a couple of minutes. Or vibrating massages such as using a massage gun. The key is to treat not only your foot, but also your calf, like the gastrocnemius and the soleus muscles, the large muscles in the back of your lower leg, connecting your calf to your foot. And this is the holistic approach that keeps your lower body both strong and without tightness to alleviate issues caused by flat feet. Once you have released your tightened tissues, you can start stretching them. First, heel stretches. Stand with your hands resting on the wall at shoulder level. Keep one leg forward and the other leg extended behind you. Press both heels firmly into the floor. Keeping your spine straight, bend your front leg and push yourself into the wall. Feeling a stretch in your back leg and Achilles tendon. Hold this position for at least 30 seconds and repeat on the other foot. A tight calf muscle, medically termed as equinus, is considered to be the most common cause of flat feet. The tight muscle transmits a pronating force on the foot, resulting in arch collapse. A dedicated stretching program can alleviate the flattening effect. An effective stretch for the Achilles tendon is the downward facing dog. Ensure that you pike your hip as high as possible whilst keeping your heels firmly on the ground. Once we have stretched out the tightened tissues, we need to strengthen them. First exercise, arch lifts. So stand with your feet directly underneath your hips. Also known as foot doming, arch lifts involve keeping your feet flat on the floor and raising the arch of your foot as much as you can. Rolling the weight of your foot to the outside while keeping your heel and toes on the ground. So as you move your heel off, try to move the Achilles tendon laterally by rolling your ankle outwards. But as you do so, keep your toes on the floor. But ensure that you're not actively gripping the floor with your toes, keeping them relaxed as compared to the other parts of the foot. Effectively, as you roll your ankle out one way, your forefoot is rolling in the other way. With flat feet, the Achilles tendon is angled inwards when viewed from the back. This exercise trains your ability to roll your ankle out, moving the Achilles tendon to a vertical position. Perform 2 to 3 sets of 10 to 15 repetitions for each foot. Next exercise, calf raises. While standing, lift your heels as high as you can. You can use the wall to help with your balance. Hold the upper position for 5 seconds and then lower back down to the floor. Do 2 to 3 sets of 15 to 20 repetitions. Then hold the upper position and pulse up and down for 30 seconds. Next, strengthening exercise for the arch. The foot has many muscles that are contained within it, meaning that the muscles originate and terminate within the foot without extending into another part of the body. These muscles are called intrinsic muscles and are generally on the bottom of the foot. Patients with flat feet tend to have improperly worked or poorly developed intrinsic muscles, so a program aimed at strengthening muscles in the foot can help to support the arch. Simple exercises involve grabbing motions of the toes, such as picking up marbles or a handkerchief with the toes. So sit in a chair with the towel under your feet. Root your heels in the floor as you curl your toes to scrunch up the towel. Press your toes into your foot. Hold for a few seconds and then release. Make sure to keep the ball of your foot pressed into the floor or towel. Maintain an awareness of the arch of your foot being strengthened. Do 2 to 3 sets of 10 to 15 repetitions. Next exercise, toe raises. For variation, you can try doing this exercise in standing yoga poses such as tree pose, standing forward bend, or wide-legged forward bend. And let's use the tree pose as an example. While standing, press your right big toe into the floor and lift up your other 4 toes. Then press your 4 toes into the floor and lift your big toe. Do each way for 5 to 10 times, holding each lift for 5 seconds. Then do the exercise on your other foot. Next, heel walking or toe walking. Walking across the room on your heels with your toes in the air can strengthen muscles in the ankle and feet, such as the tibialis anterior. Repeating the exercise on your toes with your heels in the air, essentially walking tiptoe, can do the same, as well as strengthening your calves. Next, go barefoot. This is somewhat counterintuitive, as people generally believe that a flat foot needs support. When walking or training barefoot, the muscles of the foot become more active and grow stronger. Stronger muscles in the foot, theoretically, may translate into improved stabilization of the foot. Regarding other treatments for flat feet, you may wish to use an orthotic device to support your arches and reduce stress on your flat feet. They may help to improve function and alignment of your feet while providing support. Stability shoes such as motion control shoes can also help to support your arches and provide extra cushioning. Usually surgery isn't needed for flat feet unless they are caused by a bone deformity or a tendon tear or rupture, or if you have chronic foot pain from flat feet and haven't improved after taking other measures. But keep in mind that it may take a few weeks of doing these exercises before you begin to see improvements. But be consistent with your approach and continue doing these exercises even after you progress. Developing a deeper awareness of your body can help you to determine how best to adjust your posture and movement during daily activities to correct your body imbalances. Make a conscious effort to pay attention to how you stand, move, and position your body, making micro adjustments as needed. But remember that the exercises provided in this video are for educational purposes only and are not to be interpreted as medical advice, and are in no way intended as a substitute for medical consultation. Until next week, take care. Thank you for watching until the end. If you like this video, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is free of charge but will help the channel to grow. If you're interested in improving your health and fitness or losing weight, if you suffer from or wish to prevent back pain, please take a look at my book, which is now available from Amazon worldwide. Thank you.